I'm often asked how it is I'm able to get consistently great results with patients. Despite everyone's best efforts to date, oftentimes patients are falling short of what they want to achieve with their health potential. And I think it comes down to a few basic principles, a few basic commitments that I've made to patients. Number one, I have a really small practice. I have restricted the number of patients that I work with at any one period of time in order to give them my full heart, my full head, my full mind share. Also, I clearly differentiate. I split apart the diagnostic phase of my work with a patient from the therapeutic, from the treatment phase. I don't want to get into treatment and say words like, well, let's try this, or give this a go and we'll see whether it's helpful for you. I don't want to guess. I want to have some certainty going into the treatment phase. And therefore, I spend an awful lot of time in the diagnostic phase, really figuring out what's going on. I also have perfected a diagnostic process that gives me the information I need to be successful with patients. Number one, I spend a lot of time in the first phase, in discovery, and asking the types of questions in an in-depth consultation that lead me through a patient's entire health history, that help to give me clues about the types of health questions that have not been asked up until this point. And it's from that diagnostic work, it's from that initial discovery that I'm given some insight. I'm given some insight about the diagnostic testing that could be run. Maybe some tests that weren't run deeply or thoroughly enough. Maybe some tests that were never considered up until now. And it helps me to go into that diagnostic phase where I'm able to get analysis, where I'm able to get data that sheds new light, a new perspective on a patient's health issues. I then will spend time in deep analysis. I will spend time understanding the relationships between all of the data points that are coming in, the patient's history, their laboratory findings, their clinical expression, their symptoms at this point in time. And I begin to create a cause and effect map. I create a visual mapping of the root causes of their issues, all the way to how they spill out into the health outcomes and the symptoms that they're experiencing. I then meet with my patients in that diagnostic phase for a second, and maybe the most important in-depth conversation they're going to have about their health. I'm able to show them this cause and effect mapping, which connects them deeply with the root causes of their issues, where they're able to see the pattern of events that have led up to their health expression at the moment. And then I do something really wonderful, which is to go up to about 20,000 feet. And I'm able to say to them, look, here's your roadmap. If we do this, this, and this for this length of time, and I try to give my best guess, my best estimate of how long the process will take and how much it will cost, they will get to their health potential. And then I ask the most important question, I believe, which is, do you want my help? Do you want to work with me into a treatment phase? Do you want me by your side? And if the answer is yes, then on that second visit, on that roadmap visit, I will place their foot firmly on the first stepping stone of a path back to health, and I will guide them entirely until they reach their health potential. It all starts with the diagnostic workup. It starts with these two in-depth consultations, discovery and roadmap, that are sandwiching the diagnostics and the analysis in between. I charge a single fee for that work. The only thing not included in that are the laboratory testing. I do not know, neither do the patients that I work with, exactly what tests are necessary. I treat every patient like a snowflake. I look very specifically at their health issues, and I try my best to discern what will be most focused and pinpointed, laser focused, to help them understand their health issues. So once we're able to get those laboratory tests in, once I'm able to do my analysis, I'm able to take patients to a level of understanding about the root cause of their issues, and then guide them with their permission all the way through the process of getting well. Every single patient that comes to me isn't always a good fit for this process. I hope that you are. I hope that you're interested in taking the next step with me, that we can have a conversation to see if my process and my skill set is a good match for your need at the moment.